I mean, at the end of the day, I honestly think there are some fundamental things that cannot be avoided. And money is really the kicker. At one point, it was that if you don't meet certain benchmarks, you'd lose your funding. So having money tied to
benchmarks such as
the 4-hour rule. Yes, 4-hour rule. So someone who comes in has to be seen and admitted
or triaged
or discharged within 4 hours. A clinical decision has to be made within 4 hours.
To reduce waiting times in hospital emergency departments?
Yes.
But doesn't that just mean that people end up in beds in hall corridors or
worse still, they get sent home when they shouldn't be sent home, because we're going to weigh this up and decide, are they clinically at risk or not? You know, if they're low clinical risk, there's no beds, send them home.
So are you describing to me an audit culture which allows a Minister for Health to stand up and say something impressive in Parliament about how we've managed to get hospital waiting times down? Or?
Yes.
Okay, so
yes.
When the Minister stands up in Parliament and says, we've managed to get hospital waiting times down by X, well, what's the cost in terms of patient care?
Well, I think it's that the patients don't get care. They might physically get their blood test done. They might physically get their x-ray. They might physically get their script for their antibiotics. But if you really look at it, I mean, if you honestly view human beings, and this, when I first did my training, was a huge component of our education. A human being is made up of the biological, the psychological, the social, and the spiritual. All. A human being is all of these components rolled into one. I do vividly remember a patient one day who was quite distressed. I mean, not in an open, wailing, gnashing of teeth kind of way, but when you look closely at that person, you could see that they were very distressed. They weren't the one pushing the buzzer or anything. There was nothing to draw my attention to her, but when you look closely, I could see that she was crying, silently crying. And so I went over and chatted to her. Anyway, what it boiled down to was she was genuinely scared that she was going to die. I mean, she wasn't going to, but that's not the point. She was genuinely scared that she was going to, and that this was going to happen before her minister could come in to visit her. So you see, things like that, I think, the cost of focusing on money and numbers and, less waiting times, I mean, they're the stories you hear about.